Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation and chronic daily migraine survivor. I am super excited to let you know that I am here today with Katie MacDonald. Hi, Katie, how are you?
Hi, Lindsay. I'm great. Thank you.
Katie is the executive director of the Alliance for Headache Disorders Advocacy. I think many of you know who she is. She's sort of a superstar headache disorder advocate. She is one of the main faces associated with Headache on the Hill, and she's been a guest on Heads Up before. And we are here today to talk about Headache on the Hill 2020. What we did there, the progress we've made, and some of the progress we made in the previous year. So let's pay attention. It's so important for all of us to know what we are doing nationwide as a group of headache patients and headache advocates. So Katie's the person to go to for this information. So let's get started. Katie, for anyone who doesn't know, can we just start with sort of a little brief summary of what Headache on the Hill is?
Absolutely. First, I just want to thank you for having me, Lindsay. I really appreciate it. I'm excited to be here.
Thanks for being here.
So Headache on the Hill is an annual advocacy event that takes place in Washington, D.C. We bring people into D.C. in person for this event. It's a combination of people who have migraine and cluster headache disease and other headache diseases. Caregivers, family members may be joining them, providers, researchers, all coming together for the cause of advocating for migraine and headache disease.
Right.
The way this works is we bring people come to DC. We have one day where we get together and do an advocacy training. And then the second day, so Monday is always our training, and Tuesday we go to the Hill, to Capitol Hill, and we have meetings with various members of Congress.
Right.
So the people who come to Headache on the Hill are coming from all different experiences. They're not necessarily people who are politically focused.
Right.
That's not a requirement for Headache on the Hill. The only real requirement is that you are physically able to get to DC, that you're able to succinctly share your story about your journey, how you've been impacted by migraine or headache disease, and then we teach you everything else you need to know to be a part of the event.
Great. And it is quite an experience. I have done it twice. I love it. It's rewarding. You meet amazing people, and it is physically challenging. I'm not going to lie. It's not a typical advocacy event where you can show up and it's easy to get through. It's physically difficult, but it is so worth it. So each year we go to the Hill with specific asks. Can you outline really quick what the asks of 2020 were?
Absolutely. So an ask is the specific issue that we're focused on for the given year. So this year our ask was around, there's a bill that is in both the House and the Senate right now, and the bill is called the Opioid Workforce Act.
Right.
And we were going, during our meetings with our members of Congress, we were talking to them about providing their support for these bills. So the bill on the House side, we call it HR 3414, that's the bill number. And on the Senate side, it's called S 2892. And so this bill is looking, if it gets passed, it would fund 1,000 new residency training positions across the United States to focus on the fields of pain medicine, addiction medicine, and addiction psychiatry.
Right.
These are linked to, it's called the Opioid Workforce Act, because with the onslaught of additional patients needing care these days due to the opioid crisis, these are the types of providers that we need.
Right.
Now, headache medicine and headache disease is related to pain medicine, but people who have migraine and headache disease need to be treated by headache specialists specifically, not just pain medicine providers.
Right.
And so with this, we're really in favor of this bill because we believe there needs to be more residency training slots open. But we had two pieces we were asking for. One was for our members of Congress to co-sponsor or support the bill in general.
Right.
The second was we were asking that they request an amendment to this bill, which means change the bill slightly,
right,
so that it would include language that says that it includes not just residencies, but fellowships,
right,
which is a different type. It's the next level of training for people going into medicine, for doctors.
For doctors, correct.
And also that it's not just pain medicine residencies and fellowships, but it's headache medicine
right.
Fellowships.
So basically, to give a brief summary of that, we need more headache doctors, and we're amending that bill so that, or we're asking to amend that bill so that that will happen, because there is a huge headache doctor shortage in our country. For example, I live in Colorado, and there's a total of 6, and I believe there's about to be only 5 headache doctors in our entire state, which isn't nearly enough.
Exactly.
And what is the ratio of headache disorder patients to headache specialists?
It's horrible right now. So it's about 85,000 patients per provider. Right now we have 564 certified UCNS certified headache specialists in the United States and 47 million people with migraine.
Right.
So there was just a paper published actually that talks about the disparity, the lack of coverage that we have. And right now it's estimated that there's 1.2 headache specialists for every 100,000 Americans living with migraine or headache disease.
Right.
And if we were to have the right amount of providers, we would need about 8 headache specialists per 100,000 people with migraine. So this bill would, it would be funding 1,000 residency slots over the course of multiple years. But so it's not everything we need, but it would be a huge step forward.
Okay. All right. So has there been any progress? We just went to Headache on the Hill, but has there been any progress in this amount of time? Is there any updates?
Yeah, surprisingly, it's only been 2 weeks since we were there, but we have already had some progress. We've had 4 additional senators sign on as co-sponsors to the Senate bill. Awesome. And there were 4 additional representatives who signed on to the House bill as co-sponsors. So, we believe this is directly related to the meetings that our advocates had 2 weeks ago. They raised awareness. We met with about 225 offices that day. I think there was a lot of really positive feedback that we got from the meetings. I think many of the offices are still considering what their position is. But there were very few offices, unlike in years past, very few offices who said this was not something they would consider.
Right. Okay. So that is great. We already have some positive results, and it's only been 2 weeks, which is amazing to me. I think that what has been awesome to me about the experience with Headache on the Hill is it seems like there is always progress. I always feel like, until I got involved, I always felt like politics was something that you could hardly make a difference in. And I got involved in Headache on the Hill, and I'm like, wow, we are making a difference, and we make it quickly. So is there anything people can do from home at this point to help with the progress?
Absolutely. So we know there's a lot of people that can't make it to DC. And so right after this event this year, we launched an online campaign. So if you couldn't come, or even if you came and you have friends and family members that want to support you, then you can go to this website, and we'll share the link here on the podcast. But you go in and you put your zip code in your address, and that helps identify who your members of Congress are. And there's a pre-written note to send to those members of Congress that basically asks them to consider co-sponsoring this bill and or amending it. And that would be automatically directed to their office on your behalf. So it just takes about 2 or 3 minutes, and it can really make a difference.
Okay, great. Really quick, let's go back, just because I love to give an example of the good that's done through Headache on the Hill and the progress. Let's go back really quick to 2019. what were some of the asks and some of the progress that was made? Can you briefly tell us about that?
Sure. It's so exciting because we had a lot of progress last year, and I almost, we love to share the progress. We don't want people to think this is the normal, that we get so many wins in a given year, but last year was amazing. We had an ask last year. One was around Social Security and the fact that it's so difficult for people with migraine and headache disease to get Social Security disability coverage. It's horrible. So we were advocating for the Social Security Administration to add what's called a blue book listing, so that there actually is a listing for migraine and headache disease. We are asking them to issue, in the meantime, before that listing is made available, that they should issue what's called a Social Security ruling that provides information that explains what the process is that they're using to evaluate somebody who is applying for disability.
Okay.
And then we were also asking that they update their listings within 5 years, not more than 5 years. And the way we asked for this is through something called report language. So we were asking our members of Congress to request this report language to encourage these actions to take place.
Okay.
And we made great progress on that. The report language was submitted, was passed in both the House and the Senate.
Yay.
And once the report language came into being, we saw action. The Social Security Administration issued the ruling that we asked for in August of last year.
That's fabulous.
It's so exciting. It's it's a great step forward. We're still a long ways off from where we want to be with more equitable policies through the Social Security Administration, but we are continuing to work on that this year, and think over the next couple of years we're going to make some good progress.
Right. Okay.
We also, our second ask last year was around National Institutes of Health and the funding that they provide for migraine research. There's actually been a significant boost in funding through something called the HEAL initiative. And we were asking members of Congress to, again, request report language that would encourage the National Institutes of Health to issue specific, it's called RFAs, but specific calls for investigators or researchers to do research on migraine disease.
Right.
And those report language statements were also passed through both the House and the Senate. Unfortunately, we haven't had the progress on that one. We got the report language statements, but we haven't seen NIH take the action that we were requesting quite yet.
I think it's important. One of the stories I told as an advocate when I was there, it's important for people to understand how hard it is to get funding for headache disorders. When I was getting my PhD, I really wanted to work in migraine, and I was advised by my advisors to never do that, to stay in cancer, because no one would fund a headache grant. And I can't really disagree with them. It's very hard to work in this field, and that's why we were fighting for that on the Hill last year.
Exactly.
Yeah,
you've experienced it firsthand, and the more that word gets out, that discourages other providers from getting into the field, and that's exactly the opposite of what we need right now.
Exactly.
We want people to be interested in headache medicine. So
exactly.
The good news is I think we're starting to get to a point where the funding is starting to increase.
Yes.
It's now becoming a challenge with finding enough researchers to get interested in the field and apply for all those grants that are available.
Yep.
So, those are the two biggest things that were specific asks from 2019. The other one that I think is so important to talk about is our ongoing issue with getting coverage for oxygen, home oxygen use for people who have cluster headache.
Yes.
This has been a battle that's been going on for at least 12, 13 years, kind of going back and forth. And 13 months ago, the Alliance for Headache Disorders Advocacy filed an appeal with the Centers for Medicare and Medicaid Services to request that they reconsider their previous decision about not covering oxygen. And we've been working very closely with a member of Congress, Andy Harris, who's been trying to support us through all of this.
Mm-hmm.
And there's been some really exciting news just this week.
Yay.
We got a meeting in person with CMS on Tuesday this week. So Bob Wold and Eileen Brewer and Bob Shapiro and myself went to CMS and talked.
Those are some advocates for cluster, and also what is Bob Shapiro's title? Dr. Shapiro?
Dr. Shapiro is the founding president of the Alliance for Headache Disorders Advocacy.
Okay, just so people know. Okay, so go ahead.
Yes, so we met with the whole team at CMS who is in charge of coverage analysis, and Bob Wold gave an amazing presentation showing them somebody having a cluster attack and
wow. Okay.
Telling the stories of people who have lost their lives to this disease. And
Mm-hmm.
We didn't get a specific commitment about when they would review the policy, but they said they agree that the policy needs to be reviewed.
Okay.
And then yesterday, there was a hearing in front of the Secretary Azar from CMS, Center for Medicare and Medicaid Services,
Okay.
appeared before the Appropriations Committee, and Representative Harris asked him a question in front of everybody about why they still weren't covering oxygen. So
Wow.
that's a pretty big deal. For some advocacy organizations, getting a question asked in a hearing is
Right.
considered a successful year, and that was just one of the things that's happened in the last week for us. So
that is a big deal. And just to put it into perspective, when I tell physicians who aren't part of Headache on the Hill that I meet that one of the asks that we had was to cover oxygen for cluster, they're like, what do you mean? That's standard of care. What do you mean? They really have no idea that it's not covered.
Yeah, it's horrible.
Care and it's not covered. And so it's definitely something that every win in that area is so important that we keep working on it. So I'm so glad you're updating us on that. So for anyone who wants to take part in Headache on the Hill 2021, can you tell them what they do to go about to apply?
Yeah, I think the best thing for them to do is to go to the website for the Alliance for Headache Disorders Advocacy and sign up for our newsletter, because we will send out a notification next fall, when the applications open, and let you know that you can apply.
Okay.
Applications are usually open for about a month, maybe month and a half, and that's in the fall.
Okay.
And then, and the application process it just takes a little bit of time. We want to make sure that you're definitely committed to coming to the event.
Mm-hmm.
And we let people know by the end of the year if they've been accepted for what will be the February 2021 event.
Okay. Is there anything you'd like to add about Headache on the Hill before we close today?
I love Headache on the Hill. It's
So do I.
Bigger than Christmas for me.
Yeah.
It's my favorite event of the year.
Uh-huh.
I went my first time 6 years ago, and it was life-changing for me. I realized what a difference each individual person can make by sharing their voice. And like I said at the beginning, you don't have to be political in nature to make an impact. It's just, if you're willing to share your story and let people know how you've been impacted, then you can help change the course of this disease for everyone who's impacted.
So true. So thank you so much, Katie. I think that it's so important that we update everyone on the hard work, how the hard work is paying off. And for people who haven't been or can't go, we let them know what's happening. And if they can go next year, how they can do that. So I love to come on and talk about Headache on the Hill and where we are and what's going on. So that's it for today's episode of Heads Up. The National Headache Foundation would like everyone to know that if you have questions or problems related to your headache disease that you cannot find answers to, the NHF has a hotline you can call, and they will do their best to get you an answer. So you can call 888-NHF-5552. That's 888-643-5552. If you are just stumped with something related to your headache disease, and they will do their best to help you out. So that is it for Heads Up today. Thank you, Katie.
Thanks for having me. I appreciate it.
And everyone join us again next week. See you soon. Bye-bye.